Hello everyone, I am Dr.R.Aditya Vadan, working in SLG hospital as a consultant pulmonologist. Today I will be talking about asthma and COPD. Let me first talk about COPD. COPD is a chronic obstructive pulmonary disease which is usually seen in smokers, I would say. So any person who smokes 20 cigarettes per day for more than 20 years are most likely to develop COPD. COPD can also develop in other conditions also, but it is very rare. So COPD patients will lose the elasticity of the lung, so and they are more prone to develop a lot of pulmonary infections. So how do you identify a patient with COPD? They'll have breathlessness, they have increased cough and sputum, and the breathlessness and cough and sputum will be same throughout the year. That is one distinguishing feature of COPD and asthma. When it comes to asthma, it will be varying between different seasons, different climatic conditions. So this is the major difference, differentiating feature between asthma and COPD. So I will not go about the treatment aspect, but I will be telling you about the ways to prevent COPD. You should not smoke. Not just smoking, there is first hand smoking, there is second hand smoking, there is third hand smoking. So you should not be also not exposed to any kind of smoke. When there is a person who is smoking beside you, kindly ask him not to smoke or go to a place where there is no smoke. COPD can also develop in patients who are exposed to biomass exposure. Previously, maybe 20 years ago, 30 years ago, most of the patients are exposed to biomass. They used to cook with woods and all. That kind of smoke also, when patients are exposed for a longer duration, they develop COPD. COPD and asthma present almost in a similar way. So distinguishing features of COPD asthma is also important, which I will be covering later. So next, this is a few things I told about COPD. Next I will tell about asthma. Asthma is usually present from the younger age group, usually, but patients can also develop asthma in older subpopulation also. And asthma is a hyperreactivity of airways. Just patients who are allergic for dust, smoke or anything are predisposed to developing asthma, but not all allergic people can develop asthma, but some of them, or nowadays most of the population are developing asthma. Asthma can also develop if there is a post-viral fever. For example, in this pandemic there is COVID. Any patient who has recovered from COVID are prone to develop asthma. So asthma can be present childhood usually, but can also present in adults, but can also present post any lung infection or any viral infection for that matter. So so next, as I have already told you, asthma can be differentiated from COPD by its seasonal variation, exposure to dust or smoke. So these patients with asthma and COPD are more prone to develop infections. So how to avoid infections in these patients? These patients should get vaccinated with pneumococcal, vaccinated with influenza. Influenza is yearly vaccination. Pneumococcal vaccination can be every 5 years. So there are new guidelines for pneumococcal vaccination also, which will be revised every couple of years or every year. So I would advise patients, either asthma or COPD, who has cough, breathlessness, increased sputum production, should come visit a pulmonologist specifically and should be treated accordingly. And we have to differentiate asthma from COPD. Both can mimic each other, and sometimes both can have together also. So for that, we will do necessary investigations, we will give you necessary medications, and will advise you necessary lifestyle changes to to treat these conditions. Thank you.